Most women have tried everything. Better food, more exercise, less sugar, and still, that belly stays. What most people never realize is that not all belly fat is the same. Where it comes from, why it forms, and how it behaves are completely different depending on the type. And if you have been targeting the wrong kind, that is exactly why nothing has been working. Subcutaneous belly fat. This is the soft, pinchable layer that sits directly under the skin on the stomach. It is the most visible kind, and the one most women are most familiar with. When you press your fingers into your stomach and feel something you can grab, that is subcutaneous fat. Most women carry more of this type than men do, and that is not accidental. Estrogen, the primary female hormone, actively directs fat storage toward the hips, thighs, and stomach. It is part of how the female body has always been designed to function. This type builds up slowly and steadily, usually when calorie intake stays just slightly above what the body burns each day. The accumulation is gradual enough that many women do not notice it happening until months or even years have passed. The important thing to understand about subcutaneous fat is that while it affects appearance and can impact confidence, it is actually the less medically dangerous type. It sits outside the organs. It is frustrating, but it is not the one quietly causing internal damage. Visceral fat. This one is different, and it is the kind that matters most for long-term health. Visceral fat does not sit under the skin. It lives deep inside the abdominal cavity, packed around vital organs like the liver, pancreas, and intestines. You cannot pinch it or feel it from the outside. A woman can look relatively slim and still be carrying a significant amount of visceral fat internally. That's what makes it particularly dangerous. It's linked directly to chronic inflammation, insulin resistance, elevated blood pressure, and a meaningfully higher risk of heart disease and type 2 diabetes. What drives it more than almost anything else is a diet high in refined carbohydrates and sugar, combined with chronic poor sleep and prolonged stress. The body treats these conditions as a sign that it needs to store emergency energy fast, and the area around the organs becomes the storage site of choice. Waist circumference is often used as a rough indicator. A measurement above 35 inches in women is generally considered a signal that visceral fat may be present at concerning levels. Hormonal belly fat. Many women reach a point in their lives where the stomach starts changing and nothing obvious explains it. Eating habits are roughly the same, activity levels have not dropped dramatically, but the midsection keeps growing. This is often hormonal belly fat, and it comes specifically from shifts in estrogen, progesterone, and related hormones. During perimenopause, which can begin as early as the mid-30s for some women, estrogen levels start declining. For most of a woman's life, estrogen has been directing fat toward the hips and thighs. As it falls, that pattern changes. The body begins storing fat in the abdomen instead. This redistribution is one of the reasons why women who have always been relatively straight through the middle suddenly find themselves carrying weight in a completely new place. It's not purely a calorie problem, it's a hormonal signal telling the body to store energy differently, and diet and exercise alone often produce slower results until that underlying hormonal environment is addressed. Cortisol belly fat. Stress has a physical address in the body, and for many women, that address is the stomach. When the body is under prolonged stress, the adrenal glands continue releasing cortisol, the primary stress hormone. In short bursts, cortisol is useful. It sharpens focus, mobilizes energy, and helps the body respond to a threat. But when stress becomes chronic, cortisol stays elevated, and the effects on fat storage become significant. High cortisol tells the body to hold on to energy reserves, and it specifically encourages fat to accumulate around the midsection. Women under sustained stress, whether from demanding jobs, difficult relationships, financial strain, or simply the weight of carrying too many responsibilities at once, often find that their belly is the first place new weight appears. Sleep deprivation makes the problem considerably worse. Even a few nights of poor sleep are enough to push cortisol levels up and keep them elevated throughout the following day. The frustrating part is that stress itself makes healthy eating harder, recovery slower, and motivation lower, creating a cycle that keeps reinforcing itself. Bloat-related belly. Not everything that makes the stomach look larger is actually fat, and this distinction matters more than most people realize. Bloating is one of the most common reasons women feel their midsection appears bigger than it is, and it can happen rapidly, sometimes within an hour or two of a meal. It comes from trapped gas, water retention, slowed digestion, or the body's reaction to specific foods. Common triggers sugars include dairy, gluten, beans, onions, carbonated drinks, and artificial sweeteners. For women with irritable bowel syndrome or small intestinal bacterial overgrowth, bloating can be a near constant issue that dramatically changes how the stomach looks and feels throughout the day. The key difference between bloating and actual fat is timing. Bloating tends to appear and disappear relatively quickly. It often worsens through the day and feels better in the morning. Real fat accumulation happens over weeks and months, not hours. That said, chronic bloating can sit on top of genuine belly fat and make the overall picture harder to assess clearly. Postpartum belly fat. Pregnancy changes the body in ways that take far longer to reverse than most women are told to expect. After giving birth, the abdominal area often looks and feels different, not just because of fat, but because of structural changes to the muscles themselves. During pregnancy, the growing uterus pushes the two central abdominal muscles apart, a condition called diastasis recti. This separation can cause the belly to protrude even after significant fat loss has occurred, because the muscles that normally hold everything flat are no longer aligned. Beyond the structural issue, the hormonal environment after birth actively works against fast fat loss. The body is recovering from an enormous physical event. If a woman is breastfeeding, the body tends to hold on to additional fat stores as a reserved energy supply. Sleep deprivation from newborn care keeps cortisol elevated. All of these factors together mean that postpartum belly fat often requires a different, more patient approach than standard weight loss strategies. Lower belly pouch. Many women carry a small but persistent pocket of fat specifically in the lower abdomen, in the area just below the navel. This is one of the most complained about areas and also one of the most resistant to change. The reason comes down to receptor biology. Fat cells in the lower belly have a higher concentration of alpha-2 adrenergic receptors, which are receptors that essentially put the brakes on fat breakdown. Other areas of the body respond to fat-burning signals more readily. The lower belly holds on. Even women who are lean overall can carry this pouch, and it often becomes more noticeable in the days before menstruation, when water retention increases and the abdomen naturally feels fuller. Hormonal shifts through the monthly cycle can make this area fluctuate significantly in appearance, which sometimes creates the impression that fat loss efforts are not working, when the real cause is temporary fluid changes. Liver-related belly fat. The liver is central to how the body processes fat, sugar, and alcohol. When it becomes overwhelmed, it begins storing fat within its own cells. This is known as non-alcoholic fatty liver disease, and it is far more common than most people realize. It develops primarily from diets high in fructose, particularly from processed foods and sweetened beverages, as well as from excess alcohol consumption over time. The belly associated with liver fat tends to feel different from the soft, pinchable kind. It often creates a sense of fullness or heaviness in the upper right side of the abdomen, and the stomach can appear firm rather than soft. Many women live with this condition for years without hypnosis because the symptoms are easy to attribute to other causes. Reducing sugar intake, especially from drinks and packaged foods, tends to have a direct and relatively quick effect on liver fat compared to fat stored elsewhere in the body. Age-related belly fat. The body changes quietly across the decades, and the stomach is often where those changes become most visible. As women move through their 30s and into their 40s, muscle mass naturally begins to decline. This is a normal biological process, but it has a direct effect on body composition. Muscle tissue burns more calories at rest than fat tissue does. As muscle decreases, the body's daily energy needs fall gradually and without announcement. If eating habits stay roughly the same, that quiet gap in energy balance adds up over months and years. At the same time, hormonal shifts are altering where new fat is stored, pointing it increasingly toward the abdomen. The result is a gradual thickening around the middle that many women describe as feeling like their body has changed the rules without warning. Resistance training is one of the most effective responses to this type, because rebuilding and maintaining muscle directly addresses the metabolic change driving it. Insulin resistance belly fat. Insulin is the hormone responsible for moving sugar from the bloodstream into the body's cells for energy. When cells stop responding to it efficiently, the body compensates by producing more. Chronically high insulin is one of the most powerful drivers of fat storage, and it directs a significant portion of that storage towards the abdominal region. Women with insulin resistance often notice that meals heavy in carbohydrates seem to cause disproportionate weight gain around the middle, even when overall calories are not especially high. There's a strong and well-documented connection between insulin resistance and polycystic
polycystic ovary syndrome. In PCOS, insulin dysregulation is often a central feature rather than a secondary effect,
which is one reason why belly fat is so commonly associated with the condition. Managing blood sugar through consistent physical activity, reduced refined carbohydrate intake, improved sleep, and stress management tends to produce more meaningful results for this type than calorie reduction alone.